Thank you, Deputy Premier. It's a real privilege of mine to be here with you today to talk about the amazing work that community health in general is doing in Victoria. And I'd like to thank the Deputy Premier and the Victorian State Government for this fantastic investment in people's mental health. My name's Nicole Bartholomeusz, and as the Deputy Premier mentioned, I'm the Chief Executive of Cohealth. Cohealth is an organisation based in Melbourne's north and west, delivering vital healthcare to people. We're one of 28 Victorian community health services right across Victoria, doing a lot of work during the pandemic. Since the pandemic began, Cohealth has played a vital role in supporting community. We've been front and centre with testing, vaccination, providing outbreak management support, but also delivering a vital service in partnership with Melbourne's West to assess people who have tested positive to COVID-19. And through that assessment centre, we've assessed 15,000 people and provided them with access to much needed clinical and social care to support their recovery. And this wonderful initiative that occurs in the West has actually kept 80% of people who have been diagnosed with COVID-19 out of our hospitals. It's a fantastic initiative. Through the work of the Assessment Centre, we've identified the significant increase and burden of people's mental illness. We know that COVID-19 isn't just a physical impact, it is having a long impact on people's mental illness. And the initiative that's been announced in the last month to establish 20 pop-ups right across Victoria is such an important initiative to respond to this need. So Cohealth will be delivering this service across 4 local government areas in Melbourne's north and west. This week we opened our doors with a team of mental health wellbeing coaches delivering services in the City of Brimbank, the City of Melton, the City of Moonee Valley, and right here in Melbourne CBD. We've got a fantastic team, experienced with people, working with people with mental illness. We also have a team of peer workers, a really important part of our workforce, who have lived experience, have experience of poor mental health and a recovery process. And that part of the workforce is so important to build trust and connection and to support people to access care. During the pandemic, we've really seen an increase in people's fear, anxiety, psychological distress. It has been triggering for people who already suffer from poor mental health, but it's also triggered new responses. And so this really important service is here to help all of those people. We're really proud to be one of the partners in wellbeing, and the service can be accessed, as the Deputy Premier mentioned, through the Partners in Wellbeing service. It's so terrific also to be here today, hearing those amazing vaccination rates, and we know that by putting in good support and services for people, making it accessible, ensuring that people know where to access care is really important. Part of the work at Cohealth is to work with people who are most vulnerable in our community. And we do that by going out and reaching out to those people, not waiting for people to come to us. So through our networks, through our partners that we work with in community, we'll be supporting people to access these much needed mental health services. So once again, thanks for the opportunity to speak to you today, to share the news about these mental health pop-ups, and again, thanks to the State Government for this important initiative. And I'll now hand over to Ben Cowie.